For me, it just happened to be reflux type symptoms. So I just want you to know that it's not just, oh, it's reflux symptoms that can be unusual. Any type of unusual symptoms that are brought on by activity and relieved with rest should be a red flag.
Heart attack symptoms are often misunderstood because they don't always present as the classic chest pain or arm numbness seen on TV. Dr. London emphasizes that symptoms resembling heartburn or reflux, especially when triggered by physical activity and relieved by rest, can be warning signs of coronary artery disease. This means that if you experience any unusual discomfort during exertion that eases when you stop, it's important to take it seriously and seek medical evaluation. The heart can masquerade its distress in many ways, including jaw pain, elbow pain, shortness of breath, or fatigue. Being attentive to these subtle signs and not dismissing them as minor or unrelated issues can be life-saving. Early recognition allows for timely diagnosis and intervention, potentially preventing severe heart attacks or the need for invasive procedures.
I cannot come up with one single thing that does as much damage to every organ in the body as smoking cigarettes. And look, it's incredibly addictive. And I know that, and I pass no judgment because I know how difficult it is.
Smoking remains the single most harmful habit for heart health and overall well-being. Dr. London highlights that smoking increases the risk of heart disease by magnitudes and damages virtually every organ. While quitting is challenging due to nicotine addiction, the benefits of cessation are profound and far-reaching. Beyond smoking, limiting sugar intake and avoiding processed foods are critical because these contribute to inflammation and fat accumulation, which damage blood vessels and increase heart disease risk. Alcohol, including red wine, should be consumed cautiously. The antioxidants in red wine do not outweigh the harmful effects of alcohol when consumed in large amounts. Making conscious, healthier choices about what you consume daily can significantly reduce your risk of heart disease and improve your quality of life.
Shop on the outside of the store. Stay out of the aisles. All of the canned and jarred items are on the shelves. The longer the shelf life, the shorter your life.
Dr. London advises a simple but effective grocery shopping strategy. Focus on the perimeter of the store, where fresh produce, meats, and whole foods are located, and avoid the inner aisles filled with processed, canned, and packaged foods. These processed items often contain hidden sugars, preservatives, and additives that contribute to inflammation and heart disease. While it's unrealistic to avoid all processed foods, aiming for 80% whole foods and 20% processed is a practical goal. Keeping a food journal can help you become more aware of what you're actually eating, revealing hidden sources of empty calories or unhealthy ingredients. Eating a diet rich in proteins, healthy fats, and colorful vegetables supports heart health and overall wellness. Planning meals and shopping with intention not only benefits your heart, but also saves money and reduces impulse buying.
But also on that list is sleep and recovery. And that is my Achilles heel. And it comes from several fold. One, I've been on call for 25 years and my thermostat is set now on DEFCON 1, all the time.
Sleep and recovery are often overlooked but vital components of heart health. Dr. London candidly shares that despite his disciplined diet and exercise, his biggest challenge is getting adequate rest due to the stress and demands of his profession. Chronic poor sleep keeps the body in a heightened state of stress, which negatively impacts blood pressure, inflammation, and heart function. Prioritizing sleep hygiene, managing stress, and allowing time for the body to unwind are essential steps to support cardiovascular health. Even if you maintain a healthy diet and exercise routine, neglecting sleep can undermine these efforts. Recognizing your own sleep patterns and making adjustments to improve rest can be a powerful lever in preventing heart disease.
You can simplify it into two buckets, really.
Okay.
So if you think about the heart as a pump, that pump requires energy. It requires oxygen and nutrition and all of those things to be able to get you up out of your chair and get to the refrigerator and climb the flight of stairs and all those things.
Heart disease primarily falls into two categories: coronary artery disease, and valve disease. Coronary artery disease involves blockages in the arteries that supply blood to the heart muscle, which can lead to heart attacks. Valve disease affects the heart's valves that regulate blood flow direction and efficiency. When valves malfunction, the heart's pumping ability diminishes, potentially causing heart failure. Understanding these two buckets helps clarify why symptoms like shortness of breath, swelling, or chest discomfort occur. It also underscores the importance of early detection and treatment. While surgical interventions like bypass or valve repair address immediate problems, they do not cure the underlying disease process, which requires ongoing lifestyle management and medical care.
Think about the pump working, and everywhere that the heart is pumping to is clamping down, trying to maintain the blood volume in the body. Even though it may be adequate, the tone in those blood vessels is real.
High blood pressure forces the heart to work harder against increased resistance in the blood vessels. This chronic strain causes the heart muscle to thicken and the chamber size to shrink, reducing efficiency and eventually leading to heart failure. Additionally, elevated blood pressure damages the inner lining of blood vessels, promoting cholesterol buildup and accelerating artery hardening. Managing blood pressure through lifestyle changes and medication when necessary is crucial to reduce this strain and prevent long-term damage. Even if high blood pressure runs in your family, you can influence how it affects you by controlling diet, exercise, stress, and medication adherence. Early detection and consistent management are key to protecting your heart.
Women are not little men, and that's so true. Just like children aren't little adults, like their physiology is very, very different.
Heart disease manifests differently in women compared to men, partly due to physiological differences and partly because of historical male bias in medical research. Women often experience heart disease in smaller blood vessels and may have symptoms that are less typical, leading to misdiagnosis or delayed treatment. Hormonal changes during menopause, especially the drop in estrogen, increase women's risk by reducing anti-inflammatory protection. Awareness of these differences is critical for timely diagnosis and treatment. Women and healthcare providers should be vigilant about atypical symptoms and advocate for appropriate testing. The growing focus on women's heart health is improving outcomes, but continued education and research are essential.
So first, you call 911. That's, let's start there. Now, when we did this post, the most popular response was call 911. No, I'm going to clear my browser history before I call 911. I was like, are you kidding me?
If you suspect you are having a heart attack, immediate action is critical. Dr. London stresses the importance of calling 911 right away rather than delaying or doing anything else first. While waiting for emergency services, turn on your porch light and unlock your front door to facilitate quick access for EMS. Sit or lie down in a comfortable position to avoid injury if you lose consciousness. Taking a 325 milligrams aspirin and chewing it can help by thinning the blood, but only if you have no contraindications like allergies or bleeding issues. Informing family or friends ensures someone knows your situation and can assist if needed. Quick response can save your life and reduce heart damage.
It's not about perfection. It's just about progression for all of us, me included.
Dr. London reminds us that improving heart health is a journey, not a destination. Perfection is unrealistic, but consistent small steps add up over time to create meaningful change. Whether it's improving diet, quitting smoking, increasing physical activity, or prioritizing sleep, incremental progress compounds. Recognizing that setbacks are part of the process helps maintain motivation. The goal is to integrate heart-healthy habits into daily life so that missing them feels like a loss, signaling true lifestyle change. This mindset shift from all or nothing to gradual improvement empowers sustainable health benefits and reduces the risk of heart disease.